Let's go straight over to the Deputy Leader of the Reform UK Party, Dr. David Bull. Good evening, David.
Good evening to you, Kev.
Quite a big day, obviously, in Parliament. The parliamentary report on the COVID crisis and the government's handling of it. Clearly the narrative is to point the finger at the politicians, to Boris, to Matt Hancock, to the cabinet. They made all the mistakes. But if you read into the report, whilst no one is saying that our government was blameless, they did make mistakes. I think their care home policy was a catastrophe. But in terms of their general handling of the COVID crisis and whether or not, if they'd have locked down earlier, lives would have been saved, everything they did, it says this in the report, everything they did was upon the advice of Chris Whitty, the Chief Medical Officer, the Chief Scientific Officer, Sir Patrick Vallance, and the experts of SAGE. So in fairness to the government, they always said we're following the science, and that's what they did. They followed this scientific advice. So what we're hearing today is politicians should hang their head in shame. Boris should resign. Matt Hancock should resign. They're disgraceful. We're not hearing anything about the people who actually gave them the advice. Where are we? Do you not think that we should be at least hearing from some of these scientific advisors and wondering whether or not they should be considering their positions?
Yeah, I mean, I think it's far more nuanced, actually, and you're right to read that into it. I think what it shows is it's a fairly damning report, this Joint Committee from Science and Health, and it shows that actually, I think underlying this was the real human tragedy. And if you look at the detail of it, what it's saying is if the government had got things right or done things slightly differently, then half the people who died in that first wave may well be alive today. And I think that the phrase that came out for me was the fact that ministers were operating under a fog of uncertainty. And when I read that report, essentially, it seems to have been pushback from the scientists. And you're right to say that the scientists were actually saying, let's not lock down now. Let's go for this hypothesis of herd immunity. And that way we can protect the NHS. Now, I'd argue, and I've said this to you before, that actually the NHS is there to protect us and not the other way round. And of course, there were a number of problems with the government strategy that was given to them by those scientists. And ultimately, the scientists are there to advise, but it is up to government ministers to make policy. And that is where I think it went fundamentally wrong.
Now, also, we understand now, it seems to me to be generally accepted because we know because of the progress of the virus over the last 18 months or so, that lockdowns, do not in the end prevent deaths. You end up with the same results as if you hadn't locked down. Look at Sweden. So there is a reluctance now to ever lock down again because people do not feel that lockdowns are a particularly effective measure in stopping the spread of the virus. So why then is it being contended that we should have locked down earlier when possibly the best thing to have done would have been not to have locked down at all, like Sweden?
I think the fundamental answer is we just weren't prepared and we didn't have capacity. Back in when I was a medical student, we had 300,000 beds. We now have 140,000 beds. So part of the lockdown, and I've said to you before that essentially the area under the curve remains the same. But in those initial phases, essentially by adopting a lockdown, what you do is you buy yourself time. And in fairness to the government, they'd never dealt with anything like this before. We had no idea what we were dealing with. We couldn't test enough people. We did 29,000 tests in 2 months, whereas other countries like Spain were doing 50,000 tests a day. And of course, then there was a catastrophic decision to send people home from hospital to liberate that capacity to care homes. And of course, they weren't tested. And that is where it went fundamentally wrong. And then, of course, we kept our borders open. So we had these porous borders. We were worried about countries such as China and Israel, but actually a third of the cases came from Spain. So actually, whilst I would agree that actually I'm not sure lockdowns do change much, certainly in those initial stages, what lockdown does is it buys you time. It bought the government enough time to actually work out a strategy moving forward. And one of the things that the report goes on to say is actually the thing that we did extremely well was the vaccine rollout. And I admire everyone who was involved in that because it was a game changer.
Other elements of this report, as I say, everybody, all the press, the media, the newspapers, I don't blame them. This is the way it rolls. But they're focusing on pointing the finger at the politicians. However, there are other criticisms in this report that are going under the radar that shouldn't. One of the most interesting, in my view, is the accusation that we relied far too much on mathematical modelling, that it played, and I'm quoting, that it played too influential a role in UK scientific advice. In other words, Neil Ferguson and his model makers, who terrified the hell out of the Prime Minister and the then Health Secretary by saying that there could be 500,000 deaths if you're not careful, working on these models, this report has concluded that we must never rely on mathematical modelling to quite such an extent ever again.
Well, of course, they're mathematical models. And I think in every single model, they were way out. They still are way out. And therefore, the government had to make decisions based on the best modeling that was available to them at the time. And so it's very difficult for a government to make a decision like that. Now, just going back to this idea of herd immunity, which is one that I always favoured, the idea was that essentially you would shield the elderly and the vulnerable and let those people who don't suffer long-term sequelae get COVID and then recover. That way, the numbers of people in the population who have immunity to COVID would rise, and therefore, as a group, we would then be immune. Now, the problem was the government didn't do that. They didn't shield the elderly and the vulnerable. And of course, then they backtracked and instigated the lockdown. So the problem wasn't, I don't have a problem with the fact that they locked down. I think either you say we are going to lock down and buy time, or you don't. But what they did was you sort of neither Arthur nor Martha, so that they then decided to lock down about a week too late for those 20,000 people who lost their lives. So again, it was indecision, it was this fog of uncertainty. But again, you're right, they were being guided by the scientists and their modeling has been proved to be wrong every single time.
And also, Sage, Whitty, Valance were at one. They were advising the government not to lock down. So that's why Boris didn't lock down, because he was getting scientific advice not to do so. A little unfair to point the finger at him as being the only one to blame.
I know. I think it's a very difficult position for any prime minister to be in, because essentially, and Boris Johnson is a libertarian, he didn't want to lock down. He wanted to follow this idea of herd immunity. And of course, the reason that Sage and Whitty and all the rest of them wanted to delay that lockdown was because they were worried about pushing the curve into the winter, where they knew the NHS would be totally overwhelmed. And then, of course, they realized that this was not going to work and that they had to pull lockdown forward earlier. So the prime minister was in an invidious position and a very difficult one indeed. But we didn't get everything wrong. We did some things incredibly well. I think many countries around the world have suffered, but I think countries like Sweden have showed that lockdowns per se as the only tool do not work. And we should never go back into another lockdown, particularly now we've got this level of people who've had both vaccinations. It's been extraordinary, the rollout of the vaccine. And of course, it's thanks to British science that we had one of those vaccines.
Yes. So in terms of lockdowns, I would predict that we'll never go into one again, because you're quite right. I'm no expert, but I think anybody with half a brain can work out that if you lock everyone in their houses and ban them from speaking to each other or coming into contact with each other, a virus is going to have trouble spreading. So it will buy you time, it will delay the spread. But what we now know, with the benefit of time, the benefit of hindsight, and how many have we had now? How many lockdowns? 4, is it? In the end, you end up with the same statistics. They do not, in the end, reduce the number of deaths, but they may postpone how quickly those deaths happen.
Well, that's right. And also, one of the other things I think we need to factor into this is how good is the immunity that is derived from the vaccines? And we simply don't know the answer to that. What we are seeing is that immunity is waning after the second vaccine, which is now why they're rolling out the third vaccine. And that brings us on to the really controversial topic of vaccinating children, because if we're saying that actually vaccine-induced immunity is less effective than getting COVID itself and acquiring your immunity naturally, then there are questions about our policy going forward. But I am nervous they're going to lock down again. I don't know why I'm so nervous about it. I just feel that if the scientists produce yet more modelling that shows there will be some sort of catastrophic overwhelming of the NHS, then the government will act. Now, I really hope the government don't do that, because the science shows that with this level of vaccination, we have the majority of the population immunised. But ultimately, we have to get on with life. We've got the real problems here are all those people who are suffering from cancer who aren't being seen. Those people, and flu is going to be a major problem this year. You mark my words. There'll be many admissions and deaths from flu far above the normal levels that we would see. And of course, those people waiting for elective procedures, I just don't think the NHS will ever cope. So the idea of protecting the NHS, I think, is for the birds now.
Also in this report, I want to get on to vaccinating kids in just a second. I know it's a subject close to your heart, David. But the report also, and I think this is really interesting, criticises the way that the public were deterred from seeking medical help during the first lockdown. Then it says to, quotes, protect the NHS, as the government put it at the time. So what this report is saying was they must never do this again, because what they did is they terrified the whole nation. People who were very sick thought it would be uncommunity spirited of me to go to the hospital now, because the government says I've got to protect the NHS. So this terrifying the nation into not bothering the health service is severely criticised, and we must never see that again, must we?
No, we mustn't. And of course, those people who are most in need didn't go, as you say, to their GP and have suffered as a result. So that's why I'm saying all these undiagnosed cancers, people who actually desperately need treatment, haven't been seen. We also adopted something called total triage in primary care. So the fact is you couldn't see a GP unless you've been triaged by someone on a telephone before you actually were let through the system. And what we also know is that face-to-face consultations have dropped significantly from something like 80% to under 50%. And that's simply not acceptable. But I don't think the GPs are going to go back to seeing patients face to face, because I think ultimately they quite like the lifestyle that they're now accustomed to, and that is not good for patient care. Younger people can be seen without being seen face to face, but those with chronic problems, multi-system problems, and those with more worrying, complicated conditions really have to be seen in person. But ultimately, there is a capacity problem. We simply don't have enough hospital beds. We don't have enough doctors seeing people in the hospitals. And so in terms of those elective procedures, I don't know how we'll ever catch up. I don't know what we're going to do going forward. And putting £29 billion into the health service is merely a sticking plaster. Now, I think what we need is some sort of bold, ambitious, radical reform of the health service, because unless we do that, I don't think the NHS is going to be fit for purpose, and that will start very soon.
Yeah, no, I couldn't agree more. It's very worrying. Let's move on to vaccinating kids. Only 11% of children between the ages of 12 and 15 in England have been vaccinated. So there's clearly a massive reluctance, in my view, for children to be vaccinated. Up in Scotland, it's 25%. So they're boasting, saying we're doing much better. But that's still 75% of kids in Scotland have not been vaccinated. Now, if you look at all the reasons that are being given from that, they're talking about technical difficulties in rolling it out, liaison between headmasters and the NHS not being quite as good as it should be. Nobody seems to want to confront is what I would suspect is the main reason: parental reluctance. Parents are saying no to this jab for their kids because there's no medical reason to do it, and there are doubts over the long-term effects.
I mean, I'm starting to see more and more doctors like me saying what I've been saying for months and months, which is essentially, if you've immunized the elderly and the vulnerable, and if children don't get a self-limiting condition, and if they don't tend to suffer and they recover, why are we vaccinating them? Well, the government is saying, well, we're vaccinating them to protect the elderly and the vulnerable who have already been vaccinated. And parents aren't stupid. I think parents are very worried about what are the long-term side effects. These vaccines have not been around a very long time. We certainly, on the AVRs, on the adverse drug reactions, on the yellow cards, we're seeing reports of all sorts of conditions which need to be investigated. I'm not saying that they do lead to those conditions. What I'm saying is we need time to investigate them. And remember, these drugs have only been licensed under emergency legislation. Yeah. So if I do feel very strongly about this. I am nervous. If I had children, I'd be nervous to allow them to be vaccinated at this particular moment in time. And also, there have been technical problems. I know at schools around here that their children have gone in and then they haven't been able to deliver the vaccine, and the children have all been told, well, you're not actually going to have it. So for those parents, they're on such an emotional roller coaster where they're, it's literally dividing husbands and wives and different partners, because one may be for it, one may be against it. And I'm not sure that the scientific evidence is wholly there to say that these are totally effective and totally safe, and we have enough long-term safety studies on them.
Well, it certainly isn't, David. Otherwise, why else would the Joint Committee on Vaccination and Immunisation, the top government advisory board on these issues, have recommended against vaccinating children?
Well, that's right. So the JCVI did recommend against. Yeah, on balance. That's why
I think a lot of parents are saying, well, no, if the JCVI say no, so do I.
So where did following the science come from? If the JCVI said, well, actually, on balance, I don't think we should vaccinate children, and the government then deliberated, but then, as you know, they then lent on Whitty, etc. And of course, they then came back with the chief medical officers of the devolved regions, devolved nations, and they actually changed their minds and then instigated vaccination for 12 to 15-year-olds. So for parents, I think they are saying, well, something smells a bit fishy here. You've got a scientific body saying that on balance, we don't need to give them. And then suddenly we're being told by those health advisors or by the health chiefs of the devolved nations that we should be giving them. So something doesn't quite add up. And I think that's why parents are very reluctant to get their kids immunised.
Totally agree. Mixed messages, they never help. David Ball, Deputy Reform UK leader, thank you so much for your time. Always a pleasure to talk.